Hello students, today we are looking at the topic reproductive health, and at the end of this lesson you should be able to define reproductive health. You should be able to state some types of harmful traditional practices. You should be able to mention how to care for your reproductive organs. You should be able to state the importance of prenatal care. You should be able to list the effects of STI and HIV/AIDS on fetus and infants. We'll stop there. What is reproductive health? Reproductive health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matter relating to reproductive system. For the fact that you don't have any disease or you don't have any infirmity related to reproductive system does not mean that reproductive wise you are healthy. But mentally you must be complete, physically you should be strong, and socially you should be able to interact properly. So the complete physical, mental, and social well-being is what is regarded as reproductive health, and not just the mere absence of disease or infirmity in all matter relating to reproductive system. We're going to look at some harmful traditional practices that can actually affect reproductive health. Some of the traditional practices that is being engaged in that can actually affect reproductive health is female circumcision or female genital mutilation. There are some communities that they circumcise. They feel that female children, when they could be promiscuous. So what they do is they cut off parts of their genitals. And these are harmful practices that can actually affect, that could go a long way to probably mentally affect such individual or physically affect such individual. The next one is face deformation. This is another example of harmful traditional practices. Face deformation, tribal marks, this is an example of harmful traditional practices. Alright, this is still an example of face deformation. Alright, there are some communities they engage in this, and this deformation can actually be permanent. Alright, they can be permanent in such individual. Yes, this is another one. This is another one. Okay, this is another one. They have to live with the stigma for the rest of their lives. Alright, the next one is killing of twins. There are some communities they believe that twins, they are taboos, they are evil, so they have to kill them. So these are harmful traditional practices. Another one is child labor. Child labor, you see underage children hawking, engaging in different sorts of things that are actually beyond their age. All right, so child labor in this in cases like this, you see some children being knocked down on the road by moving vehicles. You see some being victim of rape and so many other things which can actually affect their reproductive health. Let's move on. Drinking of concussion. Drinking of concussion, fine, some people see it as culture, tradition, but all this, they could actually have negative impacts on our internal organs like your liver, your kidney, even your reproductive organ, your ovaries, fallopian tube, your womb could be affected. There are some people, they feel Isabiwere, once you give it to a pregnant woman, the baby comes out easily. But all these, they have negative impacts on reproductive health of individuals. Another one we want to look at, another harmful traditional practice we want to look at is early or forced marriage. You see young girls that are still underage, they are being forced into marriage. And this, when they finally get pregnant, in the process of giving birth, it could lead to many complications for them. All right. Okay, this is still another picture on early marriage or forced marriage. And lastly, the last harmful traditional practice we're going to look at is son preference. There are some communities that they believe that even if you give birth to 20 girls, if you don't have a son, it's you don't have a child yet. All right, it's an harmful traditional practices, and it could have a lot of mental impact, all right, on the reproductive system of the of females. Let's move on by looking at prenatal care. What's prenatal care? Prenatal care is the health care you receive while you are pregnant, all right? When you are pregnant, those health care that you receive, they check you, check your weight, check your blood, check your urine. Those are the things that are referred to as prenatal care. Importance of prenatal care: one, to monitor your weight and your blood pressure. It's important that pregnant women, they monitor their weight so they don't get underweight or they don't get overweight, and they also check their blood pressure too. Then two, when you go for your prenatal checkup, they check the size of your uterus, they check the shape, just to be sure that the fetus is growing properly and it's developing normally. Then when you go for your checkup, they also check your urine. It's a time where you check your urine to be sure that your sugar is not too high, or protein in your urine is not too high. All right. Then lastly, it helps the doctor to identify patients who have risk or complication, or who may have risk or complication, like gestational diabetes. You see some pregnant women that while they are pregnant, their diabetes, the sugar level shoots up. Preeclampsia, resource compatibility. There are sometimes that the mother is resource positive, the baby is resource negative. When you get to SS3, you will be taught about resource factor, all right? So it's also a time to check if you're allergic. There are some pregnant women, they are allergic to some certain types of drugs, they're allergic to some certain kind of drinks. So it's a time where you find out that, oh, I'm allergic to this particular drug, that means I must stay off it. I'm allergic to this particular type of drink, I must stay off it, at least for this period while I'm pregnant. All right, let's move on. How can we care for our reproductive organs? So far, we have seen reproductive health, harmful traditional practices that can affect our reproductive organs. We have seen prenatal care, importance of prenatal care. So how can we care for our reproductive organ? One, by having your bath and your shower daily. All right, as students, as young girls and boys, it's very important for us to keep ourselves clean all the time. All right, when you get home from school, go to the bedroom, you shower. This will keep your reproductive organ and the rest of your body clean. Then number two, avoid tight underpants or clothing. All right, imagine if you have to wear a very tight pants or underpants, you imagine how uncomfortable you will be. Imagine how your genitals, especially the males, how your genitals will be so uncomfortable. It could cause pain for you. All right, so make sure you get the right size of underpants for yourself. Then thirdly, as girls that use tampons or sanitary pads, you have to change between 4 and 6 hours, all right, to prevent toxic shock syndrome. All right, so it's very, very important so you don't get infected below. All right, then the next one we are looking at is for you to eat healthy. Don't just eat anything, gala, indomie, fish roll, fish pie, egg roll. No, you have to eat healthy and eat well balanced diet. All these, they sum up to give us healthy reproductive health. Then you exercise regularly. All right, It's very important. Drink a lot of water, get enough sleep, and lastly, maintain a healthy weight. We're going to stop there. In the next video, I will conclude on reproductive health. Thank you.